Welcome to Emergency Office Hours. My name's Danny, and today I wanted to talk about nitroglycerin. Before I get into the video, don't forget to like and subscribe to our page, as well as check out the official Emergency Office Hours website, TikTok, and Instagram accounts, all linked in the bio. Let's get started. In the emergency room, you will be administering nitro on a pretty regular basis. In my own emergency room, it's even loaded in our code meds cabinet. Oftentimes you will be giving it in the sublingual and topical routes, however, you may need to give it in the intravenous route as well. Regardless of how you're administering it, just make sure to keep a close eye on your patient's blood pressure, and it'll be a good idea to have them on the cardiac monitor as well. I'll get into the reasons shortly. Nitro can be ordered for patients with hypertensive crisis, pulmonary edema, angina, and myocardial infarctions. The latter two being the most common reasons I've administered it in my own nursing practice. It works by relaxing vascular smooth muscle to decrease cardiac workload, and this is significant in the coronary arteries and the venous system. It does dilate the general arterial system, but this is usually at higher intravenous doses. You may be wondering how vascular dilation leads to decreased cardiac workload, so let's get into that. I'll start by talking about coronary artery dilation. You may have heard that nitro works for MI because it dilates the coronary arteries to perfuse past the blockage. While this is true, don't forget that its purpose is to decrease cardiac workload, and this is achieved by decreasing afterload. Afterload is the force the heart must work against in order to eject blood out of the left ventricle. If we are dilating the coronary arteries, we are decreasing the amount of pressure that the heart must overcome in order to perfuse the myocardium. If we decrease that cardiac workload, we are decreasing the oxygen demand of an already taxed heart. Remember that statement. We'll see it again on the venous side. Shifting to venous dilation, nitro works by decreasing preload. Preload can be defined as the amount of stretch in the ventricles at the end of diastole. This is essentially when the ventricle is at its greatest volume. Nitro achieves this preload reduction by therapeutically decreasing the amount of venous return to the right side of the heart. If you recall your anatomy and physiology prereqs for nursing school, you might remember the principle Starlings Law. It states that the more the heart fills with blood, the more the myocardium stretches, which leads to an overall stronger myocardial contraction. When considering the cardiac output equation, cardiac output equals heart rate times stroke volume, that's this part of cardiac output regulation. During an MI, we don't need an excessively strong heart contraction. What we need is what's necessary to support hemodynamics without overly increasing cardiac workload. So by decreasing venous return and preload, we therapeutically decrease that stroke volume, which can decrease the oxygen demand of an already taxed heart. As you may have noticed, I keep on saying therapeutically decrease stroke volume. And that's because if we overdilate the venous system and excessively decrease the venous return and stroke volume, we can cause hypotension, the major adverse effect of nitro administration. This is why I had mentioned the importance of keeping a close eye on your patient's blood pressure and placing the patient on a cardiac monitor for any associated rhythm changes. If this happens, we need to restore blood pressure, and we can achieve that by administering fluids and correcting the excessive preload reduction. I hope this video on nitroglycerin was helpful. Don't forget to check out our platforms linked in the bio, and tune in here for more emergency office hours.